Hey, my name is Amanda Camp, and I'm applying for the Family Nurse Practitioner program at Jacksonville State University. I'm a 2005 graduate of Southside High School and a 2009 graduate of Jacksonville State University with a bachelor's degree in nursing. When I was in nursing school my last semester, I worked as a patient care tech at Regency Point in Gadsden, which is an assisted living facility. After I graduated from JSU, I was offered a position to fill a leave at Regency Point. So my first official nursing job was as a nurse at Regency Point, and I worked with their assisted living patients as well as in their specialty care unit, which had patients who had Alzheimer's and dementia. And after working there for a really short time, I was offered my very first hospital job, which was at UAV Highlands in Birmingham. Here, I worked on an orthopedic floor, and I took care of patients who had come in for elective procedures such as total hip, total knee, any kind of ankle procedure. I took care of those patients, and I was also able to take care of patients who were admitted from the ER who had maybe a fracture or they had fallen and they needed surgery. So I was able to take care of them preoperatively, get them ready and send them to surgery, and then take care of them postoperatively as well until they were ready to go home or to a rehab facility. And on this floor, I did a lot of educating. I did a lot of educating about total knee and total hip precautions after surgery, a lot of infection prevention care, how to keep their surgical sites from getting infected once they went home. And I also did a lot of educating about medications, such as how to give Levinox shot or about new medications that they were on after surgery that they were not on prior to surgery. And I was also able to do a lot of dressing changes. I took care of external fixators, anything that the post-op orthopedic patient needed, I was able to take care of that on this floor. And occasionally I would be able to float down to the floor below us, which was a medical floor. And down there I would take care of patients who had an array of different problems, from pancreatitis to pneumonia to congestive heart failure. You never knew what you were going to get. And I really enjoyed floating down there because I liked that each patient had something completely different going on, and I could go in and look at the complaints that they had and the symptoms that they were having, and I got to work together with the teams down there on how we could have the best patient outcome. So after working there for about 2 years, I honestly just decided I did not love the job, and so I applied for the job that I'm at now, which is at Gadsden Regional Medical Center, and I work in surgery. I work primarily on the neurosurgical team, so I do all things backs, necks, and brains. And so that would include any kind of elective back surgery like a fusion, a spinal cord stimulator. We do anterior cervicals, or we do trauma if a patient has fallen and broken their neck. I would help fix that. And then anything involving the brain, like a VP shunt, subdural hematoma, intracerebral hemorrhage, any brain surgery, I get to assist with that, which is a lot of fun. I really enjoy it. My primary role is as a scrub nurse, but I also circulate a fair amount also. When there's no neurosurgery, I have the opportunity to help with orthopedic surgery or general surgery, and occasionally in pre-op, I'm flexible and I don't mind going wherever they need me if there's no neurosurgery. And I enjoy the variety of doing something a little bit different every once in a while. When I first started in surgery, that was actually the first time that I saw the advanced practice nursing in this role. There are a lot of nurse practitioners who work for a surgeon, and they see patients in the office, and then they come scrub with them in surgery, and then they also take care of the patients post-operatively on the floor. And after watching them, that just looks like something that I would really love to do. And so that's what originally got me interested in becoming a nurse practitioner. And the more that I've learned about it, I've talked to some of them, I've talked to nurse practitioners who work elsewhere, and it's become a passion of mine, something that I really want to do. And so that's why I'm applying for this program. And while I think that I would really like to work for a surgeon, I'm open to what clinicals will bring. I look forward to trying out different areas and seeing the role of a nurse practitioner in different clinical settings. So I don't know, maybe I'll change my mind once I get into clinicals on what I want to do once I graduate. As I mentioned in my paper, Dr. Gene Watson has a theory that I've adopted as my own personal philosophy, and that is that we should be more focused on caring for a patient instead of just being focused on curing the patient. And I remember when I first started in a nursing school, like I went in on a clinical day with a list of things that I was going to do for my patient that day. And as I have practiced nursing, I've learned that nursing is not a list of things that you check off every day. We really have to focus on total patient care and adapt our care based on each patient. Each patient is care is based individually. And I get to live out this example every day. When I go see to my patient in the holding room in the morning, they're nervous and they need me to listen to them and to answer their questions. And it would be really easy for me to go in there and check consents, make sure they've had nothing to eat or drink today, make sure they're not wearing anything removable, and then just whisk them off to surgery. But I really have to stop and take time and listen to their concerns. I need to really make sure that they understand what we're about to do to them, what sort of surgery that we're about to do. I need to make sure they don't have any questions. And sometimes that may mean that I have to call the surgeon to come back in there and answer a question that he may have answered 100 times. But I really have to advocate for my patient because they are my number one priority, and I want to make sure they're comfortable before we go back to surgery. And that may be answering post-op questions, and it may be just assuring them that I'm going to call their family when we start. But I really make sure that I focus on total patient care rather than just whisking them back to surgery and getting surgery started. So that is one way that every day I'm able to really care for my patient instead of just curing them and being focused on their symptoms. When I worked in Birmingham, I was able to be the charge nurse occasionally, and so that meant that I was able to make assignments. I was able to look at all the orders that physicians were putting in and making sure that they were carried out. And it also gave me an opportunity to just help the other nurses. If they were busy with one patient, I would be able to go check on another patient that maybe had been calling out. And I was also able to, if they needed me to call the doctor while they were busy with something else, I was able to do that too. So a lot of that was just helping other nurses out. And both in Birmingham and at Gadsden Regional, I'm a preceptor. So we have a lot of new employees right now. So I have the opportunity to do this a lot. And basically, I orient them to our unit, and then I teach them job-specific skills, how to scrub specific surgeries or what things we may need for a case. I'm able to help them do all of those things. And another way that I get to be a leader is just every day. There's only 4 of us on our neurosurgical team. So one lady is the coordinator, but she has a lot of work to do. And so I'm able to step into a leadership role and help her get those things accomplished. And that may be calling the surgeon's office and getting things ready for tomorrow, or calling downstairs and making sure our carts are built correctly. But I'm able to do that every day. And one of the projects that I'm working on right now is a surgical care infection prevention project, which we are looking at all things that might be contributing to surgical infection. And so we look at our patient selection. Are we having them wash with the antibacterial soap? Are we making sure that antibiotics are administered correctly? And are we repeating those antibiotics if surgery goes over a certain amount of time? Then we also are looking at how we're cleaning our supplies, how we're cleaning our room, and as well as post-operatively, are we putting good sterile bandages on these patients so that when they go home, their surgical site's not already contaminated. So that is the project that we're working on right now, is surgical infection prevention. And as I mentioned earlier, as a nurse practitioner, I think that I would really like to work for a surgeon and round with them and scrub in surgery and see patients in the office, but I'm just really open to what clinicals may bring. I look forward to the opportunities that being a nurse practitioner brings as well. So I'm excited to get started, and I may end up loving my pediatric rotation or my maternal rotation. I'm just excited, and I look forward to all those opportunities. And I thank you for your consideration, and I hope to hear from you soon.